key issues and takeaways that I heard today are that we need to change the delivery architecture of healthcare, the way we pay providers, and the way we reward patients so that we get the best marriage of provider excellence and patient self-management of health. And finally, that we need to have some serious change management efforts because the change is huge and many of the obstacles are not related to the merits, but are more related to people's fears about what the future might bring. One of the major changes that we can make positively for the delivery system of healthcare in which I'm involved is to broaden the number of venues where care is delivered. There is a supply available of nurses to give not only flu shots, but other kinds of immunizations in retail clinics, schools, pharmacies, and workplaces, community centers. There are opportunities to do more telephonic and online contact with people, and there are opportunities to create some new models of care delivery where we have more salaried professionals who are rewarded for excellence as opposed to throughput. That all can be done right now. The biggest single issue that I think we need to address for high-value care is to understand that we are treating the whole person, not just a single medical condition or a set of medical conditions. We have to get beyond the medical condition and look at the person and what got them to this point in their evolution and in their need. The symposiums like this really help further the cause because they become a way of diffusing and presenting good ideas. I've learned about organizations that are doing some things that I believe need to be diffused throughout the entire system. And the system ultimately is going to succeed because innovation is shown to work. People copy it, relationships spread the word, and then but the symposium helps be a catalyst for that to happen. I guess my most important insight from being involved with management indirectly of healthcare is that, as Dr. Wood said today in quoting a study done in Iowa, people ultimately want to feel optimal about their ability to function in the world and to contribute and to be valued. Health is a tool toward that direction. It's not the end point. It may be a necessary tool, but it is not sufficient. We have to look at the whole person and maximize human potential if we're really going to realize the full potential of healthcare reform.